All right, let's talk about something I see in the clinic all the time, a condition that's way more common than you might think: pancreatitis in cats. And the reason it's so challenging is that it's a real master of disguise, often hiding behind signs that are super subtle. We've all been there, right? Your cat just seems off. Maybe they turn their nose up at their favorite food, or they're just sleeping a bit more than usual. And you ask yourself, are they just being a cat, or is something wrong? Well, let's dive into that, because those little vague clues are often your cat's way of telling you something really important.
So first things first, what in the world is pancreatitis? I know, the name sounds a little complicated, but I promise the idea behind it is actually pretty simple. Okay, so the pancreas is this small organ tucked in near the stomach. But don't let its size fool you, it's a total workhorse. It has two huge jobs. First, it makes hormones like insulin to keep blood sugar stable. And second, it creates these really potent enzymes that are absolutely essential for breaking down food. It's a tiny but mighty organ for sure.
Here's the best way I've found to explain it. Think of the pancreas as a highly secure factory. Its main product: powerful digestive juices. Now, normally, this factory manufactures these juices, packages them up safely, and they stay inactive. They're switched off until they get shipped out to the small intestine, where they're needed to digest a meal. Well, pancreatitis is what happens when there's a major accident at the factory. For some reason, the safety protocols fail, and those powerful enzymes get activated inside the pancreas itself. And when that happens, they start to digest the pancreas. This causes a huge amount of inflammation and pain. It's a classic case of the right tool in the wrong place at the wrong time. So the big question is, what causes this factory meltdown? And this, honestly, is where things get a bit mysterious. It's one of the most frustrating parts of dealing with this disease for both vets and cat owners. Yeah, look at that number. It's pretty staggering. In over 95% of pancreatitis cases in cats, we never find a single specific cause. We call this idiopathic, which is really just a fancy medical term for it happens without any known reason. It just starts. But even though we can't point to one trigger, we definitely see patterns. Pancreatitis rarely shows up alone. It often comes along with other inflammatory issues, like inflammatory bowel disease or problems with the liver. So the takeaway here is that it might not be about one single cause, but more of a sign that there's a bigger picture of inflammation going on in your cat's body. And that brings us to the most important part for you as an owner: recognizing the signs. And this is tough because cats are absolute ninjas when it comes to hiding illness. Their symptoms can be frustratingly vague, so you really do have to become a bit of a detective. Now, this is where cats really differ from dogs or people. We tend to think of pancreatitis as causing dramatic vomiting and terrible belly pain. But in cats, the signs are so much quieter. Just look, the top two symptoms are simply being tired and not wanting to eat. And notice how low abdominal pain is on that list. That's not because it doesn't hurt. It does. It's because cats are so stoic, they'd rather hide in a corner than let you know they're in pain. This disease also tends to show up in two main ways. There's the acute form, which is like a wildfire. It hits hard and fast and can make a cat really sick really quickly. And then you have chronic pancreatitis, which is more like a smoldering ember. It's a lower-grade inflammation that can cause those episodes where your cat just seems off for a few days and then gets better and then has another off period later. So you've noticed those subtle clues, you've trusted your gut, and now you're at the vet's office. How do we actually figure this out? Well, this is where we become a team. It's a true partnership, and we have to piece this puzzle together. I think it's really important to know that there isn't one simple blood test that just gives us a yes or no answer. It's not that easy. Your vet is going to be that detective, gathering evidence from a few different sources to build a strong, confident case for what's going on. So that diagnostic path usually involves three key things. It always starts with your story, what you've been seeing at home, and a good, thorough physical exam. Then we'll run some blood tests, and there's a great, very specific one we use that measures an enzyme that really only comes from an inflamed pancreas. And finally, if we need more proof, an abdominal ultrasound lets us get eyes on the pancreas itself to see if it looks inflamed. And now for the best part, the road to recovery. Once we have a diagnosis, our entire focus shifts to what we call supportive care. We don't have a magic bullet to cure it, but we have lots of ways to support the cat's body so it can heal itself. And honestly, with that support, the outlook is usually really positive. Treatment really boils down to 4 main pillars. Number 1, hydration. We have to get fluids into them to support their whole system. Number 2, nausea control. We use powerful medications to stop them from feeling sick so they'll even consider eating. 3, pain relief. Even if they're hiding it, we know it hurts, so we make them comfortable. And 4, nutritional support. We want them eating as soon as it's safe because that's a huge part of recovery. And I really want to land on this hopeful note. For most cats, especially those with mild to moderate disease, the prognosis is excellent. With prompt and proper supportive care, they absolutely can make a full recovery. This is not a hopeless diagnosis by any means. So if you only take one single thing away from our chat today, please let it be this. Trust your instincts. Those vague little signs, just being a bit tired, leaving a little food in the bowl, that is your cat's loudest way of asking for your help. It's a quiet call, but it's an important one. And that really leaves us all with a final question to think about, doesn't it? Knowing just how good our cats are at hiding their discomfort, how can we become better observers? How can we learn to listen more closely to the quiet ways these stoic little creatures ask for our help? Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.